Okay, this time we're going to talk about laser gum recontouring, or recontouring. It can be done or accomplished without a laser, but we use a laser here. What happens is sometimes people have what's called a gummy smile, or they just show too much tissue, where there's an unevenness to their gum tissues. So gingival recontouring is the nicer way to say it. It's a treatment method that addresses this uneven or bulky gum tissues, which can give a more symmetrical or beautiful gum line that can look a lot more natural than without. People with this problem typically call it a gummy smile, but there's a lot more to it than that. But it can give a person the appearance of really short teeth. Some people, their teeth really are short. You've worn your teeth down, so it's not the gums that are the issue. And you would need to crown the teeth or veneer the teeth. But sometimes just not enough tooth is showing. And so the excessive amount of gum tissue, it just would need to be removed. So by adjusting the contour of the gum lines, teeth can appear a lot more full and uniform in size. The gum lines are more even, and the smiles can look a lot more natural or beautiful. We often recommend gum recontouring in conjunction with other things to enhance results. I mean, oftentimes when I'm doing porcelain veneers, that's a perfect opportunity to do some minor changes. And in some cases, I do them the exact same time that I'm prepping the tooth for the veneers, and sometimes I want a little bit more predictability. If I'm doing quite a bit of change, after things heal, we want to see how they heal before we contour or create the shape of the porcelain veneer. So sometimes it's the same time as prepping the veneers, and sometimes it's a completely different visit. We usually describe it as a pain-free process, but we do get you numb most of the time for this. Now, if it's just a slight contour, something that's not quite as rounded as it needs to be, the laser is gentle enough that we don't get you numb for something like, or we'll use a topical gel to get you numb for something like that. But if there's a significant amount that we're going to do, we'll get you numb. Now, there's also an issue. Sometimes the gum unevenness is not just gums. There's bone that is contributing to the uneven nature or the irregularity to the appearance. So we need to evaluate. You can't just walk in and just say, this is what I want, and we just go, sure, and do it. We do need to evaluate. We're going to have to look at x-rays to see where the bone levels are because we might need to remove some bone. Now, sometimes we can do that with minor instruments, and it's not that big of a deal. Sometimes it's pretty involved. We do actually need to expose the bone and use the normal drill-type instruments to do we call osseous crown lengthening to create the better contours for you. So sometimes it's just a soft tissue thing. Sometimes it's both soft and hard. Another thing that I like to explain to people, sometimes this is a treatment for side effects to medications. Dilantin hyperplasia is a epileptic medication or anti-epilepsy medication, anti-seizure. And what can happen as a side effect is the gums can grow. They can look puffy or full. And even to the point where they're so extreme you can't see the teeth at all. The gums have grown up so much. So those of you that have never seen this before wouldn't understand. But those of you who take Dilantin are probably all too familiar with that side effect. There's other medications that could do something similar. Calcium channel blockers can sometimes do something not quite as extreme as Dilantin. But that is a common side effect, and many people ultimately just get into a routine. They know this is just a part of life. You get your hair cut once a month, and you get your gums contoured every year or two or three, whatever your frequency is, whatever your tolerance is, because you can let it grow all the way back to where it was when you first had it treated, or you can just kind of maintain it at a certain level. So there are medications that you can do that. We use a diode laser or an ND-YAG laser if you want to get technical and are curious about what exactly we're using to do that. Sometimes with the laser, we can do it more or less pain-free or no anesthetic. If it's significant, the laser is probably not enough. We'll probably combine the more traditional methods with a scalpel to do that. We like to avoid the scalpel if possible, not just for the bloodiness factor. The laser is going to cauterize the tissue as we contour it. Post-operatively, it just doesn't hurt when you laser. So even within 24 hours, it's almost completely healed, and really 48, 72 hours later, you can barely tell that anything was done. It heals that quickly, uneventfully, and pain-free. So very, very few complications with a gummy smile treatment. So if you have a gummy smile, or you are considering porcelain veneers and know that your gum line isn't symmetrical, if your dentist is suggesting veneers but not mentioning that there's going to be some laser gum recontouring, then you should give us a call, 206-241-5533, or drtimmerman.com, drtimmerman.com.
Dr. Timmerman is known internationally with licenses in multiple states in the United States, plus Belgium and Dubai, for cosmetic, implant, and sleep dentistry, with fellowships in the International Congress for Oral Implantology and the Academy of General Dentistry, and a diplomat in the American Board of Dental Sleep Medicine. He is your dental expert.